we are going to talk about a meta-analysis which demonstrates the efficacy of long-term ticagrelor monotherapy for the treatment of patients with type 2 diabetes mellitus following percutaneous coronary intervention. As we all know, type 2 diabetes mellitus is a risk factor for the development of coronary artery disease. And in patients with acute coronary syndrome, guidelines recommend a potent P2Y12 inhibitor in addition to aspirin. For those with complicated and advanced coronary artery disease requiring complex percutaneous coronary intervention, the risk for adverse ischemic events is even higher. Prolonged dual antiplatelet therapy use is controversial. A new antiplatelet treatment regimen after percutaneous coronary intervention should be considered. In this meta-analysis, the aim was to systematically show the impact of long-term ticagrelor monotherapy after a short course of dual antiplatelet therapy use on the outcomes in patients with type 2 diabetes mellitus following percutaneous coronary intervention. Talking about the methods of the study, electronic databases were searched for relevant publications. Studies that included patients with type 2 diabetes mellitus were selected on the basis of the inclusion and exclusion criteria. Talking about the results of the study, a total of 8,621 patients were included. Out of these patients, 4,357 patients were assigned to ticagrelor monotherapy and 4,264 patients were assigned to dual antiplatelet therapy. The results of this meta-analysis showed that long-term ticagrelor monotherapy after a short course of dual antiplatelet therapy use is associated with a significantly lower risk of major adverse cardiac events and all-cause mortality. However, no significant difference was observed in cardiac death, myocardial infarction, stroke, stent thrombosis, or repeated revascularization. Ticagrelor monotherapy was associated with significantly lower risk of thrombolysis in myocardial infarction as compared to the dual antiplatelet regimen. Coming to the conclusion of the meta-analysis, it can be concluded that long-term ticagrelor monotherapy after a short course of dual antiplatelet therapy use showed better results in patients with type 2 diabetes mellitus following percutaneous coronary intervention. Therefore, ticagrelor monotherapy after a short course of dual antiplatelet therapy use could be considered an evolution in antiplatelet therapy of this decade for the treatment of patients with type 2 diabetes mellitus after percutaneous coronary intervention. However, newer studies with a larger population size and cost effectiveness are further warranted.